Welcome to another live session with me, 𝐓𝐢𝐻𝐬. How are you all? Are you all enjoying your lovely day? As you have to make the most out of it, isn't it? Every single day is a very beautiful day that you can all have. Right. So what are you all up to? What are the things that is there? Tell me. How are you all? All are doing good? Yes? I hope all of you are doing good. Softy, good afternoon. Very good afternoon to all of you. Or if you're from the place where it is good morning, a very good morning. If you are from a place where it is good evening, a very good evening to all of you. Excellent. So welcome to Neethu's Academy Reading Live. Softy, fine. Okay, fair enough. Good. Happy to hear that. Tina Agnes, good afternoon. Siminibu, good afternoon. Reshma, good afternoon. Right, as students are getting in, as you can see on the screen, our next regular batch that is available for you is from December, January, February. So if you want to get some professional approach, please do not hesitate to contact that number. They'll be happy to assist you. If you want crash courses, yes, we do have crash courses. If you want to get other linguistic exams training, we do have that as well. So whatever that you aspire for, we have in resource. So do contact us if you need anything. Sweetie, good afternoon. Right. Now, few other things that just wanted to make to you into your kind attention. See, one and the foremost important thing is we do have 2 Telegram channels or pages. Okay. All those things, the page will be pinned. One is an official Neethus Academy Telegram page and an exclusive reading Telegram page. Because of the downflow of a lot of students, okay, they were saying, okay, they have to wait, and also we have started a WhatsApp channel as well, where you get the very same material that we're going to post on the exclusive reading Telegram page. You're going to get that in the exclusive WhatsApp channel. So there you have the link which is there. So if you have not yet joined, please do click that WhatsApp channel so that you will get access to whatever the material that we're going to discuss. All right, so whatever, whenever, however, we will try to give to the best of what we could in order for all of you. Jobita, good afternoon. Shanti, good afternoon. Jinsi George, good afternoon. Shakila Banu Saudi, good afternoon. Litty Justin, good afternoon. Jit Jiju, good afternoon. Kalai, good afternoon. Maldives. Gayatri, good afternoon. So people who are new, it's just a few names who are very new to me. If you are attending the live for the very first time, please be kind enough to tell me where you're from. Okay, now why that is important is because there are n number of students who always do support us by liking the channel, by liking the very same page that you're watching, by subscribing the channel, by following the very same page that you're watching. So they should know that they do share. Okay, so their shares are the reason there are a lot of students who are unaware that we give a lot of free classes like this. So they happen to see this and they enter. So thanks to all those lovely students who are our patrons. Lavina, good afternoon. Chintu, good afternoon. Namita, good afternoon. Cynthia, good afternoon. Again, new name. Lavina from Ernakulam, isn't it? Jia John, good afternoon. So a few other new names, and also I would definitely want to see at least one icon next to your name, because that shows that whatever that we are doing, you're also appreciating on the aspect. Nivedita, hi. Danya Jins, good afternoon. So if you feel that these classes are beneficial, please do not hesitate to share the very same link in your social media platform, because it can have an impact on another person's life. And of course, you will not share something which is not valuable, isn't it? So if you feel that this is valuable and you are getting benefit out of it, please do share. That's how I assess about how my classes are for you. All right. So Rosmi, good afternoon. And as you can see, Neethu madam is going to come just a day to go, isn't it? 10 p.m. Indian Standard Time. So do clock in, do keep a reminder, don't forget, because she will be coming with a new self-prepared writing depiction note, so which will all be benefiting you all. So do clock in tomorrow. We'll all be waiting for you there as well. Robbie, good afternoon. So nobody have told me that you're new, but I could see that your new names have popped in. If you are new, please do let me know where you're from and if you are attending for the very first time. Maria Thomas, good afternoon. So again, I repeat, we have just started a WhatsApp channel just for all of you. So if you're not yet, or if you're waiting for the Telegram page, do join the WhatsApp page where we will be posting the very same material that was supposed to be there in the exclusive reading Telegram page, just for you to get free, easy access on there till you get enrolled into it. Okay, so don't forget the new WhatsApp channel is pinned there. So please do join. All the things are free, so don't worry. Buna, good noon. Okay, fair enough. Now, why I keep on telling free? Okay, see, even though it's not something that we would definitely want to showcase on, but because there are fraudulent people available, see, they come and contact. There are fraudulent people who contact the students who are there online. Then they ask, okay, you pay that. That's the reason I had to tell this. Okay, so if somebody asks you for any money, please do not send any money. Don't give any money, because they are here with only ripping your money. Because students have fallen for those wrong traps. They have lost money. Okay, these fraudulent people will show any number of fraudulent things, saying that, okay, this we have, that we have. Do not. And there are other unethical people as well online. So be aware of it. Okay, as you can see, every day you see a lot of fraudulent things happening. They keep on bugging you, calling. So there are a number of times where I have, my contact list is less than my block list. So it's all there, but we have to be cautious enough. So be cautious enough. Francie Anish, good afternoon. Sharanya Manu, good afternoon. So as students are all there, now let's go into the first part. What is the first part? We'll be talking about a part B, where the question would be shared on the screen and you'll have to do it with time. Vinod, good afternoon. I was just saying. Okay. So are you all ready for today's session? If so, give me a quick thumbs up. Let me see how many of you are ready. The only way that I could gauge that you're all there, you're all participating, is with your comments. So please be kind enough to comment whatever you feel. We are always open for your valid feedback. Zinsi George is ready. Good enough. Siminibu is ready. Kesh, Reshma is ready. Thansi, good afternoon. Kale is ready. Shakila Banu ready. Francie ready. All right. Nivedita is ready. Okay. Zubita Thomas is ready. So as I mentioned, if you have not yet liked our page, please do like. If you have not yet joined our channel, please do join our channel. If you have not yet shared the link, please do share the link. That's the only thing that we expect from you. Softy ready, Siviti ready, Gia ready, Robbie ready, Roni Molvinson, good afternoon. Anila George, good noon. So there are a few names again popping up who are very new to me. If you're new, please do let me know that you're new and where you're from, if you could. Shani ready, Srija ready, Shani good afternoon, Feba good afternoon, Feba ready, Revati Gopal ready. Alright, as you've all said, you're ready. The question will be popping up on the screen. Sharon ready, good afternoon. Afnan, my student from Pakistan, good enough. Gayatri ready. So as you all said, you're ready. The question will be coming up on the screen. Abida ready, good afternoon, sorry. There you have the question. Please do the question in the given period of time. Once you have completed, just put a thumbs up or say done. Don't write the answers. Right. Time I've just alluded, and in between I've missed few good morning, good afternoon wishes and all. So, Sweetie, the question was, where are you from? I know that you're from our academy, fair enough. Jishta, good afternoon, because I know Sweetie is my student, I remember. Ramshina, good afternoon. Nivedita done, Francie done, Vinod done, Shakila done, Kalai done, Maria done, Revati done, Robbie done, Jobita done. Right. Jinsi Jaws done. Gia John done. Simi Dibu done. Beulah done. Sweetie done. Ammala Devi done. Jisha Krishnan done. Lavina, sorry I'm late. No problem. As long as you're all there. Right. I know that not all of you have told me, but few of you have told me. Yes, I highly appreciate, because you have to understand what is the purpose that you're here in attending this class. It is for you to make sure that you are getting benefited out of it. And the only way that you would benefit is, see, you have to take that first step. You have to start validating your presence. Okay. See, I have done. Fair enough. Sneha and Ashish done. Sunita Suni, hi sir, good afternoon. Nowadays, I'm very interested to read part B and C because of you. Thank you. Sunita, thank you very much for those lovely words, but hats off to you, because you have started taking that big step. So it's hats off to you and your effort. Okay, now if I have to, because my job is to correct you, few things that you've done is, nowadays is not 3 word, it's a 1 word. Yeah, nowadays is 1 word. Why I have to tell you this? Because you will use this in the writing as well. So when you write it in 3 words, it's going to have a problem. So nowadays is 1 word. Yeah, good enough. But thank you so much for those lovely words. You're all, the love and affection that you all pour, even though that is your capability, you're giving a small bit to us, which is, the most accolade that any trainer can get. So as you have all started saying, yes, done, 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 would you be kind enough to tell me what is your answer and where you got that answer from? That where is very important. So the question will be popping up on the screen again, but what is your answer? Where you got that answer from? Tell me, what is your answer? Shakila, B from middle para. Okay, fair enough. So the first answer I get is B from the middle part. All right. Revati Gopal is saying B. Okay, fair enough. Lavina Lalji is saying B. Okay, Lavina Justin is from Ernakulam. Okay, that's where I got a bit confused. Josna Abraham B. Simi Nimbu B. Amala Devi B from middle para. Simi middle para. Sweetie B. Nivedita B. Jiju B. Robbie P. Matthew B. Tansy B. Maria Thomas B. Okay, so all of you are saying B. Sneha Ashish B from middle line. Sharanya Manu B from middle part. All right, fair enough, fair enough. Beulah B, third and the fourth line of the para. Fair enough. Srija B. Kalai B from the first part of the para. Francianish B from third line. Sanju Matthew B from middle. Letty Justin B. Vinod B from third to fourth line. Gia John B from middle para. Gayatri Suresh B. Right, so few days you're all getting the right answers. No doubts at all. No other answers. Srija third line. Jubita B. So as you've all given your say, now let's go and dissect part B. So what are you, or what is expected? Jinsi Jaws B from middle para. See, when you're doing a part B, the first and the foremost, Lavina Lalji B from third line, when you're expected to do part B, read the question. As you read, underline the keywords in the question, understand the question. You have to relate it with regards to question. Ramshina, third line, B, okay, fair enough. Now see, Sharin Shahjubi, irrational use, okay, fair enough. Irrational use of medicine is a major global problem because why is it a global problem is the question. Okay, so you have to understand the question. If you understand the question, part B is also a piece of cake because the answers are there. Okay, medicines are overused by 50% of all patients. Now, these all, no, and all those things are considered to be very, very, very important words. Inappropriate use of medicine result in destruction of insufficient resources and prevent health hazards. So, a very big sentence, inappropriate use. So, prevalent health hazards. So, injections overused, instead, oral formulation, non-bacterial infection. So, very clearly, here destruction is there, resources is there. Those are the keywords there. Now, to go and read the paragraph. There are two ways that you can read. You can read the question, underline the keywords in the question, understand the question. That three have to be done. After that, you can read the paragraph and then pick an answer, or what I just did, read my answer option, then pick it up from the paragraph. Irrational use of medicines. Irrational use of medicine is a major problem worldwide. WHO estimates that more than half, okay. More than half, now more than 50% of all medicines are prescribed, dispensed, sold inappropriately, and that half of all patients fail to take them correctly. Irrational use of medicine is a major problem. Is it because 50% of all patient use? 50% of all patients fail to take them correctly. It's not because that medicines are overused by 50%. Okay, so straight eliminator. Now, the overuse, underuse, misuse of medicine results in wastage of scarce resources, widespread health hazards. So that is where inappropriate use of medicine, destruction, insufficient sources. So slightly pointing into B because that is a major problem. It is a major problem. So widespread health hazard, that's the major problem. Examples of irrational use of medicine include too many medicines, polypharmacy, inappropriate use of antimicrobials, inadequate dosage, non-bacterial infection, overuse of oral formulation would be more appropriate, failure to prescribe in accordance with clinical guidelines, inappropriate self-medication, often of prescription-only medicine, non-adherence of dosing regimes. Injections are overused instead of oral. They are often saying often inadequate dosage of non-bacterial infection, overuse of injection when oral formulation would be more appropriate. So this is also eliminated. Why? Injection are overused, not mentioned. So the only thing that is mentioned as what you all have got, you have all got the right answer because the right answer is a very straight answer and the answer to this question is B. So congratulations to each one of you. You have found the right answer, the right place. Everything was absolutely immaculate. That means precise. Okay. Good enough. Is there any doubts? Please do clarify. If not, we'll go into the next. Simini who's happy. Go Jinsi George is happy, dancing. Good enough, good enough. Kalai is happy. Okay, fair enough. Right. Any doubts? Anything that you want me to clarify? Lavina is happy. Okay, dancing. Good enough. Gayatri Suresh. Okay, good enough. Right, I could see all of you have, no doubts. So that means, what else could a trainer ask for, isn't it? Whatever that we have taught you, you're all finding the right way, the right answers, everything looks so precise. Very good. So as you all said that you all got all the right answers, now let's go into the second part. What is the second part? We will be talking about a part C, talking in the sense I've already fired that question. The material, everything is done. The only thing was Revati is happy, Reshma is happy. Okay, fair enough. The only thing that you should have done is take a printout, do the material in that stipulated period of time. Now I'll be firing the 20 answers. Before that, as what Shakila just told me, please do tell me how you felt about the material, because it's very important for us, because Neethu madam have to see from your valid feedbacks and then before making the next material. Legan as the C's easy material is what the first impact that I have with regards to the material. Reshma, thumbs up, okay, fair enough. Srija, easy, okay. So generally easy is what I have got from two people who have told about the material. I want all of you to say. Afnan saying easy, Sanju is saying easy, okay. Softy is saying simple material, okay, fair enough. Gayatri is saying easy. Rosmi is saying easy, good enough, good enough. Excellent. KS is saying easy. I'm sorry, Reshma is saying easy. Jobita, little tricky. Okay, fair enough. Simini Boo, easy. Saranya, okay. All right. Lavina, easy. See, I want all of you to give us that valuable feed, because you be considered as our patrons. Because no matter whatever we are, is because of how you have, told us whatever that you feel, because we are ready to mold in accordance to what is needed. Fancy, not bad. Okay, fair enough. So we always believe that your voices are always heard by us. Right. So as our students have said, basically it's an easy material. Now let's go and fire the 20 answers. And I'm sure that all of you are ready. So if so, are you already eagerly waiting for the 20 answers? And also, how many of you can say, because it's easy material, how many of you can say that you're going to get 20 out of 20? Let me see how many of you are going to tell me that you're going to get 20 out of 20. How many of you say that I'm going to get 20 out of 20? Yes? Nobody's going to say? Let's see. Shakila will, very good. Shakila is the first person to keep on responding today with the first one. Kalei, I will, very good. Jinsi George, I will. Okay, fair enough, fair enough. So you have to start trusting your feeling. Okay, I will get it, because I am always writing my exam thinking that these are right answers. Gayatri, I will. Softy, I will. Okay, excellent. Sanju, Matthew, I will. Good enough. Francie, I will. Okay. Excellent. Now you all said that you will. Now let's go into part A. Now the question will be popping up. I mean, the material will be popping up on the screen. Kirti Somaraj, I will. Good enough. Afnan, I will get it. Okay, fair enough. Good, good, good. So what are the things that you have to do in order to do part A? So part A, the whole strategy changes, because you have to always remember this material part A will only be there in front of you for 15 minutes. You have to be very much on like, let's say you have to be very vigilant. 15 minutes. That's the only time that you will ever see that material in front of you. So what is the strategy? The strategy is called skimming and scanning. Skimming means quick look. Scanning means detailed look. So the 4 text, it will be based on one common theme. These are all the things that you have to, and there are 3 types of question that is there. Each text you can take about 15 seconds to do, or to be very precise, 1 to 2 minutes for the whole 4 texts. After that, what you have to always remember is what is the strategy. As I've told you, skimming and scanning is the strategy. What are you to do when you're skimming? You're going to underline the keywords. I'm just going to show you how it is. So Legionella disease, pneumonia, lung function, breathing, bacteria, can affect lung, brain, gut. And then most people have Legionella disease, even if they're all Legionella bacteria, but some people are more likely to Legionella disease, infected disease, Legionella disease, older than 50, smoke, weaken the immune system, HIV, compromise your immune system, respiratory illness, chronic obstructive, COPD, emphysema, anesthesia. Now going Legionella disease causes, so it is all these causes, and here also it says symptoms. So causes and symptoms are mentioned in B, diagnosis in C, so which are the different diagnostic methods. And D, they're talking about therapeutic options. So it's very simple, isn't it? A, general categorization. B, what are they talking about? They're talking about all the signs and symptoms. C, they're talking about the diagnostic method. 4, they're talking about the treatment. So once I've found that, now I'm going to go to the question. So question, I told you 3 types of question. 1 to 7, these type of question are called match the following question, where the instruction remains if any of these 4 letters, and you may use any of these letters more than once. So it is a possibility that you can use same letter again and again. After that, because why? This should be by-hearted by you. You're not going to waste your valuable time reading on the day of exam because it should be by-hearted. Now, after this, you're going to go underline the keywords in the question as well. Then because part A is about keyword reference, you have to refer with the keywords. So what are the keywords? What are the methods for recognizing unusual changes? So unusual changes occurring in the lungs. So where are they talking about? So when you want to find out this thing, it should be under some test, is it? So tests are mentioned where? It is there in, so diagnosis, unusual methods in the lungs. Everything is as such mentioned, isn't it? Picture taken from the lungs. So again inside the lungs. So outside the lungs, everything is lungs. So the answer is C. Understood how you're referring? Next question. Condition that may cause harm to immune system. So where are they talking harm about the immune system and all? I underline saying that immune system, immune system, immune system. These are the conditions. So the answer to that question is A. Understood why keyword? Next, factors that indicates. Indicates means signs, symptoms. So definitely there's only one place. B. Why? Symptoms are as such mentioned. The demographic at the highest risk of contracting. Demographic means who are the most susceptible ones. Okay, so demographic means some particular signs and all those things. So what are they talking about? Who are more susceptible? That means the characteristics. That's the absolute detailing of demographic. What are the characters? You can get people if you're all those things are as such mentioned. So the answer is A. What advantages do blood tests offer? Need a second thought? This is only mentioned as such in C. Now, significant pathways through which the bacteria can enter the human body. So, ways to that the bacteria, it should be there in B. Why? Aerosol water, and all those things. So the answer is B. Effectiveness in SCAP. It is there in SCAP is there. Not yet shown. No clear. So the answer is D. So I have wrapped up on 1 to 7. Please be kind enough to tell. Next set of questions, these are called where 8 to 14 is either a word, short phrase, or okay, short phrase can be anything between 2 to 3 big sentences. Name, excellent. Jinsi George 7, 7, excellent. Jobita 7, Francie 7, excellent. That's good enough. Now let's go into in what manner through individuals inhale. So what manner? So breathing mist. So what is a manner? Aerosolized air. Okay, so AEJWATE. How often Erythromycin third. So how often? Erythromycin, how often? Where erythromycin? Erythromycin every 24 hours. For H is the answer. Extracted and evaluated for evidence. Taking these, so where are they going to talk about? It's definitely. So you may have to have, where is the exterior part? This fluid for signs. So the ACE. Now, how long does it typically take for symptoms has been exposed to the specific bacteria? Long. That means again it is. Are they talking about in B, pneumonia-like symptom that starts within 2 to 4 days. Well endured and fruitful. So anything, no need. Why go to? So get so tolerated and effective fluorons. So FLUOROQU. Yes. What medical procedure? Illuminated tube exam. The interior, definitely it should be there somewhere in the tube, inside the lung. You'll take sample, tested like an. So what is BRONCH? Question 14. Beyond, are individuals more susceptible to falling victim? It should be there somewhere in age 20. So the answer is, sorry, older than 50. So at what age? Beyond is already mentioned. So the answer A. So older than 50 is not needed. So beyond is already given in the question. So what is the age? 50. So now call, fill in the blanks question. Word, short phrase, number. Strategy doesn't change. Okay, it's a problem. Even if you repeat the smallest article, that's going to be a problem. Dash, it's not a parent indication treatment. So when compared, so they're comparing with something. They're comparing with combination therapy compared with NOTHERAPY. A dash is utilized for indication of. So where do you think the answer? Text C. Why? Blood care will use a needle. So the answer is needle. EEDLA. The patient may present with condition called dash, where all these. So again, it should be there in all those things are right. Should mention. It's called hemocysis. Next question. COPD has some persistent that for the development of. Very specifically asking you COPD, but I haven't seen COPD. It is mentioned, isn't it? Where is it mentioned? It is mentioned. So here, illness, chronic obstructive COPD, already there. So what is that? SPIRATORYILLN. Dash that also have brain and all. Any doubts? Now the problem is next one. What are they talking about? The Legionnaire disease, like, so what is that? Pneumonia. Pneumonia. Neurological gastrointestinal question. Now for the ultimate question. The person who had that might change, get infected. Habit means something that you do on a. Is there anything mentioned as habits? Smoking is a habit, isn't it? So patient smoking, not smoke. Just have to adjust it in accordance. See, at times these are the sentence are framed. You can always do smoking. Okay, pay habit of smoking. There are those questions, please do clarify. Okay. Good. Pneumonia, okay. Total. Rose me 19, excellent, good enough. Good enough, stunning, keep it up. Collect rating. 8th question.